There's literally no medical reason whatsoever for FGM to ever be done. There is no health benefits whatsoever. أنا دكتورة ريهام عواد. I am a plastic surgeon and I have a special interest في female genital cosmetic and reconstructive surgery, and I am the co-founder of Restore FGM أو ترميم ختان، وإحنا أول مركز لعناية مضاعفات الختان في MENA region. So FGM stands for Female Genital Mutilation. The way that it's been defined is any unnecessary procedure removing of the female genitalia for non-medical purposes. It consists of 4 types. Type 1 consists of the removal of part of the clitoris or the clitoral hood. Type 2 consists of partial removal or total removal of the clitoris, clitoral hood, or the labia minora, which are the inner lips, basically. Type 3 is the removal of the clitoris, the labia minora, and then the suturing or closing of the vulva with using the labia majora or the outer lips. They suture them closed, basically, and leave a small opening for urination and menstruation. It still causes, obviously, issues with menstruation, urination, even intercourse. They can't deliver because they have a very small opening. And type 4 is any other type of damage or like scraping or piercings or all of that of the external genitalia. The ones that we see most commonly here in Egypt are types 1 and 2. Restore FGM is the name we chose because we felt like it represented what we were giving to these women, which was that we were restoring not just their physical aspect, but also their hope in a life after FGM. We can help improve either the cosmetic appearance of the external genitalia, or we can help improve the function. احنا بنستعمل يعني يا علاجات جراحية يا علاجات غير جراحية. احنا أول مركز في العالم نستعمل علاجات غير جراحية عشان نحسن الوظيفة. Basically هم 3 عمليات. بنعمل جراحة اللي هي الفتح للتايب 3 أو النوع الثالث عشان نحسن الوضع اللي هي فيه، يعني تعرف يبقى عندها بتبول طبيعي، البيريد بينزل عليها بطريقة طبيعية، بتعرف يبقى في جماع بينها وبين جوزها. وبعدين الترميم البذر أو دي اللي هي الكليرال ريستوراتيف سيرجري، بنكلير الفايبرس تيشيو والسكار تيشيو وبناخد الجزء الداخلي بتاع البذر وبنطلعه لبره عشان يبقى عندها إحساس أحسن basically والوظيفة تتحسن. وبعد كده العملية الثالثة اللي احنا بنعملها، وبرضو احنا السنتر الوحيد اللي في العالم اللي بنعمل العملية دي، اللي هي تقويم الشفرات. So basically في الحالات اللي هي ما عندهاش شفرات داخلية خالص بتتشال، ممكن نعمل لها شفرات تانية. FGM is not just cutting الأعضاء and that's it. لا, it's about this experience of a little girl who is 10 years old, usually average 10 years old, who goes to either a doctor or a lady in the village or whatever her story is, having no idea what is about to happen, and then يا إما بتتخدر أو بتتكتف أو whatever، حد بيضحك عليها وبيحطها في سرير، and at the end of the day someone pulls at her genitals and cuts them off. This in itself is not just a physical cutting. There is a part of her which is very, very, very badly affected psychologically. Not counting the sexual, psychosexual aspects or complications that can happen, like obviously not being able to reach orgasm, which is a very important aspect of any woman's life. The psychological part of it ranges from anxiety to depression to PTSD, post-traumatic stress disorder, She can have feelings of being incomplete, lack of self-confidence, feeling embarrassed with her partner. The list goes on and on. We were adamant about making it a multidisciplinary center. Sometimes our patients don't need any treatment at all, and they just need a little talk about or some sexual education. When the woman comes to us and we have a consultation with her, we have a physical examination, and then we also have her have an assessment with our team psychologist. Sometimes what we find physically may not match with what the patient is complaining about. So in that case, we understand that there's obviously a psychological or a mental aspect which is affecting her, which needs to be healed. This area usually signifying a lot of trauma بالنسبة للست. فلما بتيجي عايزة تعمل عملية, she gets very anxious and she gets very nervous about someone coming near this area, and it kind of relives the moment or the day where الموضوع ده حصل. After our consultation, we come to a decision of three things. So either she needs surgery, one of the many surgeries that we do, or she needs non-surgical therapies, which would help her, or she needs psychological counseling. Maybe she needs all three, in which case we do all three for her. %87 of girls or women between the ages of 15 and 49 have undergone FGM in Egypt, and that statistic came out in 2017 by the DHS. And the WHO has claimed that over 250 million women have already been affected by FGM worldwide. It is a deep-seated cultural issue. Whether in Egypt or outside of Egypt, FGM is practiced usually for the reason of suppressing female sexuality. The theory behind it is that if they remove the one organ that God gave us to experience pleasure, and which is actually the only function of the clitoris, then a woman will not be able to have pleasure, and in which case she will be not promiscuous, if you want to say. A new one came up recently, which is that you'll hear the mothers saying, no, احنا we know انه في المنطقة بتاعتنا لما البنت تتم 10 سنين او 12 سنة بناخدها للدكتور او الدكتورة اللي هي في المنطقة وهم بيقولوا لنا هي محتاجة ولا لا. فبقت حاجة cosmetic, which is also a bunch of BS, because the doctors who perform these procedures, they do it for money. It's really important for us to let women know that our services exist, because even without treatment, just a woman knowing that she has a place like Restore FGM to come to, where she can come and talk about what she's feeling and how she's been suffering, is important. She literally turns around and leaves our clinic looking like a different person. I mean, it is literally transformative. Why leave 40 million women في مصر لوحدهم have already undergone FGM? Out of that 40 million, let's say 20 million need help. Prevention is very important, and it's really, really important إنه في الآخر FGM ده ما يحصلش خالص, zero. We want to end FGM, and one day be out of a job. That would be fantastic. I would love that. But all of the funding that is put in for FGM goes into prevention, and not any of it is put in to the restorative or the rehabilitative part, the post-FGM. طبعا if we had funding, الموضوع ده would be more accessible بالنسبة للستات كلهم. We would like to eventually train doctors so that we can have زي satellite clinics لرestore في كل منطقة في مصر.